During sick season, you're gonna be at home with your kid and they're gonna look really, really, really sick, and you're gonna think to yourself, do they need an antibiotic? And the answer is maybe, but they need to be seen to talk about it. And statistically speaking, most likely it will be a virus, okay? However, oftentimes kids do get bacterial infections, whether it's pneumonias or prolonged bronchitises or like a strep infection or an ear infection that's a bacterial, or maybe a sinusitis that's an infection, or maybe even a skin infection sometimes. It just depends. However, viruses can also look really, really bad sometimes, especially if they're like a really bad flu or a really bad RSV virus, something along those lines. And the reason why antibiotics are not always the answer is because antibiotics have very specific ways that they work. And they don't even work for all bacteria, because each bacteria needs a different type of antibiotic oftentimes. And viruses specifically are types of organisms that cannot be treated with antibiotics, unfortunately. Now, there are some viruses that can be treated, specifically in kids. Things like the flu, if they're really severe, can be treated with things like Tamiflu and stuff like that. However, those aren't even always the right answer either, especially if your kid's having certain symptoms that might be worsened by the medication. And the same thing with the antibiotics, because antibiotics are not benign medications, meaning they're not medications that don't cause any problems. They do cause problems sometimes, such as rashes or vomiting or diarrhea even sometimes. And so doctors try to be very judicious and careful with how they prescribe antibiotics, not just to avoid those big, bad, nasty, resistant bugs you hear about in the news, but also because we don't want to cause unnecessary symptoms in children if the antibiotic is not needed, which is why we're so careful with those things. So that's why it's important, if you feel like your kid might need an antibiotic or might have a bacterial infection, to bring them in so they can be examined, so we can look for those signs of the bacterial infection, or maybe even do some testing to see if there's anything we need